Well, hello, and thank you for joining secondstreet.org in our healthcare medical tourism discussion series. My name is Colin Craig, and today I'm pleased to be able to have a discussion with Dr. Serrano. He's the medical director at the BajaMed Group down in Mexico. So, Dr. Serrano, thanks for taking a few minutes to join us today.
Hello, Colin. Thank you for having me. It's a pleasure.
Yeah. And so it's really interesting to have a chance to talk to you because we've talked to a couple of your patients so far. They've both spoken very highly of the service that they received at your clinic. They talked about how nice and clean it was and the great personal care that they received. And most of all, that you were able to address the back problems. In both cases, they had back problems and they got those problems addressed at your clinic. So we know that that's one service that your clinic provides. Could you tell us a little bit about some of the other procedures that you offer?
Yeah, I'm sure. It would be a pleasure, Colin. So first off, as mentioned, thank you for having us. I'm just one of the components of BajaMed. We have over 20 specialists at our practice that day in and day out are taking care of people from all over the world and obviously our local patients as well. So as you well mentioned, the spine surgery center is definitely one of our busiest when it comes to seeing patients from Canada. Okay, and so spine surgery is definitely a big one. Orthopedic surgery as well. We also do perform bariatric surgery, plastic surgery, fertility surgery, and also some alternative medical treatments that are offered at our center as well. And those are the big ones, I guess you could say, of what we offer. But definitely the biggest one that we have in our hospital specifically for Canadians, ortho and spine surgery.
Mm-hmm. And so when it comes to orthopedic surgery, what would be a couple examples of those? Would that be hip?
Sure. So orthopedic surgery, what we see most are total hip replacements or hip resurfacing surgeries. In addition to that, we also see knee replacements, knee arthroscopies are big ones. Some shoulder scopes every now and then, arthroscopies I mean by that. And for the spine, it's going to be usually lumbar disc herniations or some kind of lower back pain that can be treated with minimally invasive surgery. And also some neck problems, cervical issues, mainly because of whiplash, things like that, chronic injuries that people have, herniations in one of their levels in their cervical spine. Yeah, those are the big ones.
Okay. And then roughly how many Canadians are coming to your clinic on an average basis, on an annual basis?
For all of the procedures, taking all of them into consideration, I mean, we've been doing this for a while now, but I mean, we can have anywhere from 100 to 200 Canadians on a year. And to be honest with you, it really depends on how the Canadian economy is doing. And that's usually when we have good years, when Canadians are having good years. And so, yeah, we've definitely ridden the roller coaster with you guys.
And I guess it would depend too on the value of the dollar, right? If the Canadian
is correct. It is a common topic of discussion with our admissions department. So usually when we give a proposal to a patient, well, I don't get involved in that area, but our admissions department usually will quote in US dollars. And so the immediate response from our patients in Canada is I mean, the exchange rate right now is 1.2 or 1.3. And so we try to be sensitive to the topic, obviously on a day-to-day basis.
Okay. And then, one of the challenges that we faced as an organization when we've been looking into medical tourism is we got some data from what's known as Statistics Canada. It's our national government stats body.
Okay.
And we could get data on the number of Canadians leaving for health or medical reasons to other countries, but we couldn't really get data on the why. Why is that's leading Canadians to go abroad? So, just in your own experience, when you're talking with patients, do they elaborate on why they're coming? Is it a quality of service? Is it avoiding a long waiting list or some other reason?
Yes, it's. I'd say that if we've had 1,000 Canadian patients that we've seen, all 1,000 of those patients are talking about this because it's very dear to their heart. And so I will start off by saying that I have had many productive conversations with many Canadian physicians, extremely talented from specialists to GPs, and mainly for follow-up reasons with patients. And so what we do find is that they are overwhelmed with work. And so the patients that usually come to us, the profile is usually going to be a patient that, let's have back pain as an example, has had lower back pain for a while, has been to see his or her GP for a while now, getting Tylenol 3s or some kind of other opioid-derived medication.
Mm-hmm.
And after a while, the patient says, I can't be doing this, or the pain gets too unbearable.
Mm-hmm.
When they finally get a referral to see a specialist, they're a little discouraged about the waiting time. And so I do want to emphasize that patients say, the doctors are amazing, but the wait to see the physicians or the specialist in this case is too long. And sometimes, if you put yourself in the shoes of a patient where you've endured back pain for a long time and you finally get that referral, you call in to try to get an appointment and they say, well, they can see you in 6 months or a year, or you have to wait 6 months for an MRI and then another 6 months for a consultation. I hear a lot of those stories. And so I think that's the main factor. Definitely the accessibility, or the quickness of the accessibility, I should say. And in addition to that, I think that the quality of the healthcare is definitely is passed on, especially in Canada, by word of mouth. It travels very fast. We've had patients from BC and patients from Newfoundland. And so, yes, that's why my Canadian geography is getting better, just because we have patients from all over the country.
Yeah.
So we've had recommendations from patients that are on complete opposites of the country. So yes, definitely once a patient talks about the quality of the healthcare, then it becomes apparent to others, because it can be a little bit, and I'm not afraid to talk about this when patients say, well, you're really going to Mexico for healthcare? And then, the patients usually have taken pictures, videos, and then it's usually the complete opposite of what the media tells you.
Mm-hmm. Yeah, to be honest, that was my first reaction when we spoke with Tracy Skinner, and she said that she had gone down to Mexico. I thought, well, this isn't where I would not naturally think that people would go. You've certainly heard of a lot of Canadians going to the United States and other countries, but I had a good chat with her, and she showed us pictures, and it looked like just any other professional clinic, and I really get the feeling that it's like most places seem to have good parts and bad parts, and
of course,
in cities, and it seemed to be the same. And like I said, both of the patients we talked to spoke very highly of your clinic. I'm just wondering can you shed some light on the incomes of the people that are coming to your clinic from Canada? Do they?
Sure.
Is it? The stereotype is that it's just wealthy people that are leaving the countries. Is that what you've been finding, or?
No, not at all, Colin. I think we've seen people from all walks of life in Canada. And even a few years back, when we were really starting to get our name up in Canada, we were at a women health and wellness conference, and we gave away a bariatric surgery for a patient. And this is a woman that told us her life story and how she had struggled with weight and diabetes, hypertension, polycystic ovarian syndrome. The list went on. But just what really captivated us about her story was, just how she was struggling to make ends meet. And at the end of the day, we chose her story over others just because of that, And so just like she was, she almost had to, well, at that point, I think the GoFundMe pages didn't exist, but she pulled some friends together to help her with money for travel and for airfare. And so, we were well aware of a commitment, because medicine is anything but a perfect science. And people want to believe that, but it is not. And so I told her, I said, you're going through major surgery. And so, we're going to help you as much as we can, but there are many circumstances that we don't know about. Anyway, she had her surgery. It went well. And but she was definitely, struggling, like I said, to make ends meet. But I would say the vast majority of our patients are anywhere from medium income to medium high. Okay, we occasionally get the very ultra wealthy patients that fly their private jets into San Diego, and then we see them. We bring them over to our facilities, but for the most part, it's going to be medium to medium high.
Yeah. Okay. That's what we've been hearing from some other people in the field. Is that it's not just the wealthy. I mean, it's understandable. You would understand if you had a lot of money and your health is on the line, you're going to spend it to try and improve your life. So I think that's. But yeah, we have heard that there are middle income people and people in that lower end of the middle income that will find a way to scrape together the money they want to get there.
Right. And I mean, it's not like they're saying I have that ton of extra cash laying around.
Yeah.
I mean, we see a lot of farmers, for example, a lot of people that with hard manual labor that obviously have something wrong in their body, aches and pains from the years. And yeah, it's usually people in a lot of Albertans, based on that. And the biggest chunk of patients does come from Alberta and those sectors that I mentioned.
Okay. And then I just want to, when we chatted on the phone briefly, you had mentioned a story about someone that had, I think they had some heart problems. They came to you for a different procedure, but then.
Yeah. This patient, we'll just call him W. He came to us for spine surgery, and I can't remember if it was over 30 years that he had not left the country. He heard about us from somebody else, very skeptical. Your prototypical Canadian farmer, just almost like arrived with the hat and his checkered shirt. And we had a conversation as soon as he got here. We do that with every patient, to ease the nerves a little. Yeah. And so he finally kind of let loose a little. We performed his surgery, and he couldn't believe the shape of the hospital, that it was just in such good conditions, very well staffed. I mean, these aren't hole-in-the-wall clinics that we work at. I mean, these are reputable hospitals certified by the federal government. So anyway, he had a fantastic surgery. His back was doing excellent. I mean, I would get Christmas cards from him, and the rest of my colleagues as well. And anyway, fast forward a couple of years, and he started saying that, he was starting to notice some issues with his heart. We knew he was a hypertensive and he had other problems. But anyway, when we did an EKG, that our cardiologist looked at me and said, "Are you seeing what I'm seeing?" So from there, we ran an echocardiogram and then a stress test and then an echo stress test. And so something was obviously going on. And so our interventional cardiologist, a fantastic physician, Dr. Leos, we spoke to the family, to his wife at this point, and we told her, what was going on, and that we had to get some imaging from his heart, direct imaging, so a primary an angiogram. And so when we were there, we noticed that there were quite a few blockages. And so in one of the main arteries of the heart, which is the LAD, and so the left anterior descending artery. And so anyway, we had already had the green light by his wife to stent the artery. And lo and behold, when we were getting there, a plaque dislodges and he starts getting a heart attack, a massive heart attack. And so, we were in the right facility, right conditions, and so we're going into red alert mode. And we had a lot of angels watching over us, as well as the patient did. And after a few days in the ICU, he made it. And I won't forget the cardiologist's words before the procedure. He said, "You are a ticking time bomb for a heart attack." And he said, "Don't take it lightly. And so if you're going to go to Canada, go right back and into a hospital." And he said, "You know what? You guys take care of it." And so luckily he had good insurance. I'm pretty sure he had Blue Cross Blue Shield, or at least the Canadian version of it. And he was reimbursed, because, obviously just unforeseen circumstances, you're doing everything you can to save the man's life. Yeah. But he did get reimbursed, and he comes almost on a yearly basis to get his health checkups with us. He flies into San Diego. Our staff picks him up. He comes over, gets complete checkups. And we're almost buddies. You know, he knows my daughter. He hasn't met my son yet. He's 3 months old, but he's a friend to us. And most of our patients, in some way, shape, or form, they develop good relationships with not only us and the medical staff, but our support staff, the nurses, and so on.
Well, that's certainly a very lucky story that he happened to be in the right place to be able to get
A lot
that.
of details I left out, but yeah, I mean, it was a very extraordinary case.
Yeah. Well, that's good, and it's good to hear that so many Canadians are actually being able to get their health problems addressed. I mean, the two people that we talked to,
Mm-hmm.
Tracy and Christina, in both of their cases, they had tried to get their back problems remedied in Canada, and the system wasn't able to help them out. I mean, they were both prescribed painkillers and that's certainly, I don't think, a good way to be living. But
Yes.
big thank you to you.
How I heard from you. I mean, we didn't know about this like video blog series that you're running, which is a fantastic effort. Like I said, I applaud your efforts because it does shed a lot of light on a public health issue. I mean, when we come into this industry, it's because we want to help in some way, shape, or form, right? And so the fact that there's more and more information about this, and there is more public awareness, and hopefully your officials, see this and see that there's something that has to be made.
Yeah, and it's an issue where we have been trying to look into it and gather data, but unfortunately, as I mentioned before, there's often sort of a lack of data about the whole issue of medical tourism and Canadian patients. And I'm glad that you've been willing to share a few minutes with us today. I know you're busy, and tell us your experience dealing with Canadian patients. So just as a final quick question for you, if people are interested in learning more about your clinic, where can they go?
Yeah, sure. So we have a group. It's called BajaMed Group. The website is BajaMedGroup.com. And from there, we branch out to some of the specific specialties, just so that, people nowadays just 2-3 clicks and they're out, right? So we've performed, some what they call landing pages, and so on, to get people to go directly to the practices that they're interested in. But yeah, we're definitely doing things not only on an individual level, but as a state. We're the only state in the world, not just in Mexico, that has made medical travel a public policy. And so the Secretary of Tourism, the Minister of Tourism in our state, he basically made a commitment, to all of the physicians in the state. And he said, we're going to make this a public policy, because as a state, nobody sees more patients from abroad than we do. I don't have the specific statistic on the city, but I mean, the sheer volume of patients that you see on a daily basis is overwhelming. I mean, a lot of our patients after surgery, after a few nights, they'll stay in the Marriott, and most of them are Americans and or Canadians that have had surgery. And so it is overwhelming. And the great thing, the take home message is that as a state, as an entity, we are doing more and more to make people feel safe about coming over to see a physician here. Doesn't have to be us, that they feel they're safe in good hands, and that they've been vetted by the state and federal level, because to be able to offer their services to patients from abroad. But yeah, I mean, if somebody wants to talk to us, we'd be more than happy to look at their cases. We usually don't charge for initial consultations. Yep. And we do it to make sure that, people don't feel like their time and money is wasted.
Mm-hmm. Well, that's especially interesting to see how your state has really embraced the idea of becoming a medical tourism destination.
Yes.
Again, I just want to express a big thank you for taking time to
likewise
talk with us, and appreciate your time.
Thank you, and congratulations again on your effort. It's fantastic. Anything we can do to help.
Thank you very much.
Have a great day.